Well, thank you very much for joining us here today for this exciting event, a panel conversation with our colleagues from the University of Minnesota Health Science Schools and Colleges. This event is taking place as part of our Health Careers Fair, an annual event that we host every fall. So my name is Laura Fife, and I'm the Director of Communications for the Pre-Health Student Resource Center, and I'll be one of the co-moderators of the panel today. I'll be joined by my colleague, Michael Salazar, who will be the other co-moderator today. Our department, the Pre-Health Student Resource Center, or PHSRC for short, supports students, pre-health students like all of you in the room here today that are exploring health career options, working to build experiences to build up a portfolio for application, and then applying to health professional programs.
Right, thanks, Laura. So today, as you know, we'll be hearing from admissions representatives from many of our health science schools and colleges here at the U of M. So we just want to take a little time to introduce everyone. So I'll kind of just call everyone's names. And if you want to just say the school that you're representing and maybe just talk a little bit about what the process is before the application and what your program looks like. So Susie, do you want to kick us off?
Definitely. Can you just repeat it one more time before you said name and then what the process looks like before people apply?
Yeah, correct. And then what, just describe a little bit about what the program is. Okay.
So hi, everybody. My name is Susie. I work in the Office of Admissions and Diversity, Equity, and Inclusion at the School of Dentistry. So we, as an admissions office, process applications for our Doctor of Dental Surgery, the DDS program, as well as dental hygiene and dental therapy. As a school, we also have a lot of residency programs, a PhD program, et cetera, but those applications are handled by different offices. So our office works with applicants throughout the application cycle. And so we're using the ADSAS centralized application that people are applying with. So we work with you to determine that your application is complete, do the first and second initial review, support the admissions committee. This year we are doing virtual interview days that we are hosting, as well as in-person visit days to augment that, and do information sessions, as well as presentations for pre-dental clubs, et cetera. So lots of ways to engage with our office. Hopefully that covered everything for you, Michael.
Yeah, that was perfect. Thank you, Susie. Olivia, do you want to go next?
Sure. Hi, everyone. My name is Olivia Buncher, and I'm the Director of Admissions for the Doctor of Pharmacy program. So this is a program that's offered on both the Duluth and the Twin Cities campuses. And the Doctor of Pharmacy is a professional program that you do after an undergraduate degree or completing prerequisites. So technically a bachelor's degree is not required. Similar to Susie, our college also has graduate programs, master's and PhD, but I'm here today focusing more on the PharmD program for those who want to become a licensed pharmacist. And I will say, no, we do all the same stuff that Susie mentioned. We have the same process, virtual interviews, in-person visit days. So my office coordinates all of those activities. Thanks.
All right, thanks, Olivia. Karen, would you like to go next?
Yes, thank you. My name is Karen Nelson. I'm the Director of Admissions for the DVM program here at the College of Veterinary Medicine at the University of Minnesota. Our campus location is in St. Paul, so we're a little bit unique. We're one of the only healthcare programs over on the St. Paul campus. And then we also have a new cohort in South Dakota at South Dakota State University. So our students who are interested in veterinary careers that focus more on rural practice would find a good fit with our 2+2 program with South Dakota State University. The typical path towards admission starts oftentimes in high school or in undergraduate school and college, where students are taking prerequisite courses required for admission. They do not need to have a bachelor's degree for admission, though about 80 to 90% of our students do enter the program with one. After you take all of those prereqs, you're about halfway to a bachelor's degree in animal science or biology, so many do continue, but it isn't required. And students typically apply their junior year, sometimes their senior year, or they graduate and apply after that. There's a lot of different routes. Some, enter the career field and come back to apply to veterinary school at a later date, and that is totally fine too. Once students enter the program, it is a 4-year professional program. They sit for a licensing exam, the state and local licensing exams, and then they are able to legally practice veterinary medicine. And I'd say about 25 to 30% of our students will go on to do an internship or a residency after graduation. And we have a suite of recruiting events as well, similar to what others have described. And we keep those up to date on our website. So if you have more questions after the session today, we're really easy to get a hold of and to explore further. Thank you.
All right, thanks, Karen. Tammy, do you want to go next?
Sure. Hi, everyone. My name is Tammy McNish. I am the Admissions and Recruitment Specialist for the Center for Allied Health Programs. And so that includes our Medical Laboratory Science program, as well as our Occupational Therapy program. So for the Med Lab Science program, or MLS program, students generally enter that program as what we call them year 3 or year 4 students. So you've either taken your general education courses either at the U or another university. You might have finished the Minnesota transfer curriculum. And so you've gotten your liberal education courses done, as well as the prerequisite courses for our program in order to apply for our program. The number of prereqs you have done will determine whether you can enter as a year 3 or a year 4 student. Let's see, we do have several different entry points into the MLS program. So besides year 3 and year 4, to earn a bachelor's in MLS, we also have a certificate program, as well as a professional master's program as well. So we have a little bit of, a couple of entry points depending on what you're interested in, where you want to go, and just when you're ready to start. And so after you have completed your coursework in MLS, that's when you are able to sit for the board or certification exam and start practicing as a professional MLS. We also have, that's what a majority of our students tend to do, is practice as MLS. Other students, we have a small portion of students who decide to, enter other avenues of health or medicine, but use the MLS degree as a stepping stone for that. And for the occupational therapy program, it is a doctoral program. You would need a bachelor's to enter that as well as all of the prerequisite courses that that entails. We don't have a required undergraduate major to enter the program. We do see a lot of kinesiology or psychology majors, background in science majors. And that program is a 9-semester program. It does include summers, and students will get their fieldwork experience done, completed as they're in the program. And after that, similar to MLS, they're able to sit for the board of certification exam to practice as OTs.
Thank you, Tammy. Crystal, I'll have you go next.
Thank you, Michael. My name is Crystal Esparza. My preferred pronouns are she and her, and I'm the Director of Admissions on the Twin Cities campus of the medical school. A little bit about the medical school in terms of campuses. We have a Twin Cities campus and a Duluth campus. We do have 2 different missions. So please make sure that if you are interested in one or both campuses, that you're just aware that we have different missions. The Twin Cities tends to serve a diverse patient population, while our Duluth campus, we are looking specifically for students interested in working with the rural community, but also have an interest in helping the Indigenous populations. A little bit about how medical school works. So it is a 4-year program. It could potentially be 5 years if you're interested in doing dual degrees. That is through our Flex MD program. typically. So I feel like a lot of individuals have many different journeys into medicine, but I would say we have two versions. I would say one version is individuals know in high school that they potentially want to pursue medicine and have already started thinking about all the things they could potentially do. Typically, what we require is we ask that individuals hold a baccalaureate degree or a graduate degree from a college or university in your country of origin or in the US or Canada. We also are looking for an individual to have completed or be in the process of almost completing their prerequisite courses. You would also need an MCAT that is within the last 3 years to apply. We do have non-traditional students though at the same time who are maybe in a second career or they're just choosing medicine now, which just means that you just need to make sure that you pay attention to those prerequisites and the courses that you need to take. But that's a little bit about the medical school. There's a whole application process that I'm happy to share one-on-one, so please feel free to reach out directly.
All right, thank you, Crystal. Dan, if you want to go next.
Thanks, Michael. Good afternoon, everybody. I'm Dan Cheng. I work in the School of Public Health as a recruitment and admissions associate director. And public health is very diverse and very broad. There's a lot of opportunities within public health. The School of Public Health itself is a very comprehensive institution in that it provides 4 distinct degrees: a Master's of Public Health, Master's of Science, Master's of Healthcare Administration, as well as doctoral PhD programs, and across multiple different programmatic areas. So if you combine them all, we have over 20 plus degree programs in the areas of public health, from epidemiology and maternal child health to environmental health sciences, biostatistics. We have a brand new degree program that's launching a Master's of Public Health in data science. So that's accepting applications right now. And so pathways, students come from all kinds of backgrounds pursuing public health. There isn't necessarily a prescribed major. Some programs do have prescribed prerequisites in terms of coursework that they want students to have as a foundation prior to application or enrollment. So definitely want to check on our website for that, for the different programs that we have that have those specific requirements. But ultimately, we're looking for students that have a commitment to public health, working with populations, and have a vast variety of backgrounds and experiences. Our PhD programs, some of them do require a master's prior and some do not. Again, so there's a little bit, it's a mixed bag of all kinds of experiences that we're looking for. And so the best thing to do as you're kind of navigating that process, what are the next things to do? Definitely reach out to myself as a starting point, and then we will connect you with various program coordinators based off of your interest. But definitely welcome students from all kinds of backgrounds and experiences.
All right, thank you, Dan. And then last but not least, Mads, would you like to go?
Yes, thank you, Michael. Hi, everyone. Good afternoon. My name is Mads Clark. I use they, them, and she, her pronouns. I am the pre-licensure recruitment and admissions coordinator within the School of Nursing. And I'm really excited to be able to be a part of this panel today to talk to you all a little bit more about each of the different programs that we have within the School of Nursing, as we have a really diversified point of entry for many different folks from many different types of studies. I do want to highlight briefly our 2 pre-licensure programs, which is of course our traditional BSN pathway, as well as our transfer BSN pathway. And then we do also offer an accelerated Master of Nursing program, which we do have students that come in from a non-healthcare background or even a aligned healthcare background, but don't necessarily know that they want to do nursing until they have already obtained a 4-year degree from an accredited university. And so there's a lot of different kind of ways to jump into nursing within the University of Minnesota. But one typical way that we have students sort of find that pathway is, of course, through a what most sort of see as a traditional pathway of looking at programs in high school and applying for a direct admission program for our first-year nursing program, which of course is all 4 years on the Twin Cities campus. However, we do have, again, that transfer option, which is actually on the Rochester campus, which students have really really enjoyed being able to get experience at Mayo Clinic, and also similar to what some other folks have said around rural community care and access. That's been really big for us to want to strengthen on our Rochester campus. And then, of course, like I mentioned, our Master of Nursing degree is for folks who didn't realize that they had a passion for nursing until later on. And so that is a really amazing program that after you complete the 16 months of courses, you actually have 18 credits that can be applied to our Doctor of Nursing Practice, or our DNP program. And within that DNP program, we have 16 different specialties, which for more information, you are more than welcome to visit our School of Nursing site. And then, of course, we do also offer a PhD program for nursing as well. All of our nursing programs are really sort of a nursing CAS application process, an interview process, and then a review process. So a somewhat more of a timeline, what that looks like is applications go out in the fall, review happens early spring, and then interviews continue to happen into mid-spring, with a admission decision coming out towards late spring. So that's just a bit of an outline of all the different programs we offer within the School of Nursing.
Wonderful. Thank you so much, everyone, for taking that time to introduce yourselves and your programs. Now, before we get into kind of our lineup of questions, I want to just cover one other piece of information. I see a couple of our attendees have already been using the Q&A function, so that is open and being monitored. Both our panelists are keeping an eye on it, I've seen, and then our coworker, Fred Williams from the PHSRC, will also be watching that chat. So feel free to drop your questions in there. We know during registration, for this event, we asked if you had any questions for these admissions folks, and y'all didn't disappoint. We got over 130 questions, student questions submitted. So needless to say, we won't have time to get through all of them today, as much as we might love to. I think we'd be here for a while. But Michael and I did do our best to really look through those, find some of those hot topics. What are the questions that were coming up over and over? And that helped shape our conversation that we're going to have this afternoon. We also will be working to try to answer many more of those questions through our social media, by utilizing and contacting our colleagues that are part of the panel today. So watch our social media, our Instagram. We're going to work on trying to get as many answers as we can to some of the more very specific questions that came through in that process. So with that, we're going to kind of dive right into what our first question is. And, a little bit pieces of what we're going to talk about for the rest of the session came out in some of the ways that y'all introduced yourselves, and that's great. And we're going to dive a little bit deeper into a couple more questions. So our first question, and we'll go kind of one by one, but I have also invited our panelists to be able to raise their hand, and if they want to expand on something someone else said, please feel free to do that. But otherwise, we'll kind of go one by one and give everyone a chance to answer. The first question is, particularly looking for advice for first and second year students, what advice do you have for helpful ways to really get started on exploring health careers and affirming that career interest to a particular health career, and starting to build that application to a program? So I'm going to start, I'm going to go the other way around, maybe from the way that we started, and I'll start with Mads to maybe reflect a little bit on that question. Thank you.
Yeah, thanks, Laura. I think one really peaceful, just plan of advice, this is how we sort of have folded it into our conversations with prospective students and even students working on some applications or even in our information sessions, has really been to do informational meetings or just getting some of that background knowledge from folks either in the field that you've come across in relation to what type of area of healthcare that you might be looking into. More specifically, when it comes to looking into nursing, especially because there are so many different types of specialization within the nursing field, definitely doing rightful research about what that looks like in different healthcare settings, whether it's a hospital or clinical setting or an advanced practice setting. That's something that we really do like to highlight for our students or even our prospective students, is what type of blank sort of care do you actively want to be doing? So for a lot of our interested students that want to do neonatal nursing, have you been able to connect with folks that are already doing that, get some of your questions answered? Is that something that you can foresee yourself doing in the future? Those types of questions and those types of connections can be really helpful in terms of building an application towards a program such as nursing, or again, a medical school program. Is just getting some of that general information down. And then of course, asking questions. That is, of course, I'm sure other people are probably thinking that too, but that's a really big part of getting to know just programs and how we can best help you as well. So those are just a few of my tips of advice. I'm eager to hear what other people have to say too.
Great, thank you. I'm gonna go back up the line. So Dan, I'll pick on you next.
Thanks. Well, and then public health is kind of out of the group of folks that are here today and programs represented, different in the sense of health careers, and that I like to kind of think of it as somewhat tangential to the patient care, right? You're not working as much in patient care, but working populations. And public health obviously has been a very hot topic these days. You can't go a day without hearing even just the terms public health being talked about. And so it's a really great, I don't want to say great, it's an interesting time for us to be in right now and considering public health as a career, because it's really representative of how it affects every day of your life, right? And so it's affecting how we work and how we go to school, how we even go shopping at the stores, all kinds of parts of our life. And so I obviously encourage students to just kind of think of those everyday experiences that they have and kind of relate that to, you know, what inspires them or what makes them interested in maybe the next step of their academic career and their interest in medicine. In my career, not necessarily here at public health, but previous to this, I would talk to a lot of students that are interested in health careers, but do have aversions to maybe working specifically with patients or in, actual medicine or surgery or whatnot. But they really want to do good for people and make healthier communities. And that's really what public health is. And that's really a great opportunity for students to explore. As Mad says, do some informational interviews and connect with professionals in the area. Specifically at the University of Minnesota, we have a public health minor. So students can start kind of getting exposed to the curriculum that's at the School of Public Health. We actually are also launching in fall 2022 public health major. So we're still working out the fine details of that, but there'll be another opportunity for students to get more experience, whether or not you decide that you want to pursue, go on into pursuing a graduate degree in public health or utilize that background to support your areas and other health careers is a great opportunity as well. And then student associations, look for a variety of connections there to meet with other students at the school with similar interests. So there's undergraduate pre-health association as well, for instance, that we work closely with and connecting them. So I guess that's what I'll share.
Great, thanks. I'll turn it over to Crystal to share her perspective.
So I think that if you are in the exploration phase, you should be visiting the Pre-Health Student Resource Center. I think that if you are still unsure on what direction to go, these are the individuals that can help you at least navigate, right, how to continue exploring, how to do maybe some of these informational interviews. Please rely on them. But I would just say the other piece in general, right, is do your research, do your homework, start looking at these schools and these institutions. What are the requirements? What would it take to get into one of these schools or one of these programs? It's important to plan ahead. But I think in your first and second year, also just take advantage of any opportunity you have to get involved and get connected, whether that's student groups, whether you have some personal desires in something that might be outside of the health sciences. I think that all of us are potentially looking for well-rounded candidates. We want to know what you do outside of this, right? Outside of this desire and passion. So don't pass up on opportunities to work with one of your favorite student groups because you feel like you need to go volunteer at a clinic clinic or you need to get specific exposure. Take your time to enjoy connecting with things that, you know, maybe aren't necessarily tied to medicine, but you would be surprised, and I'm sorry, not just medicine, but the health sciences, but you would be surprised how relevant that is going to be when you are completing your applications. So as you build your applications, I would say a great piece of advice that I once heard from a colleague of mine was start an experience journal. This experience journal should log dates, times that you participated in events, your hours, and meaningful interactions. Because as you start to build your application, as you get asked specific moments, questions, you can turn back to this notebook, this journal, whatever you're using to be able to complete your application. And at least at the medical school, you have a primary application, you have a secondary application, you have an interview that you'll potentially or hopefully be a part of as well. And you'll be able to use this journal, right, to say, okay, I'm getting ready for an interview. I may not know what questions I might get asked, but I'm so glad that I wrote down that my first year in undergrad, I had X experience with X student group or whatever it is. I think that that could be tremendously helpful.
Great. It's great hearing from all of you about this. I'm going to move on to Tammy next to see what she would like to add.
Awesome. Thanks, Laura. So I would echo, you know, what my colleagues have said here in just using your resources. Every single one of us, our schools, our departments have web pages with tons of information on it. As Crystal said, if you're not exactly sure, you know, which program you might be interested in, the Pre-Health Student Resource Center is always a good option to kind of explore them all. But on our individual websites, we also have a plethora of information of resources that you can use to your advantage. So it's there for you. So make sure that you're using that. Don't be afraid to ask us questions. I get emails a lot of time from prospective students who might say, well, you know, I don't have an advisor in that school, or I didn't know who to reach out to. But that doesn't mean that you can't find our information out on the website. It doesn't mean that we can't have a conversation with you. We would absolutely love to have a conversation with prospective students to make sure that you are in the right place that you need to be. You're taking the right prerequisite courses to make you know, your journey into our program easier. That's our job. And so definitely never hesitate to reach out to us and ask questions. Make sure you do your homework. So, you know, don't come to us and say, well, I don't know what, you know, about this. Make sure that, you know, you're asking, you know, really good questions, and you show interest, you know, in the programs and the people that you're reaching out to. For the Center for Allied Health specifically, I know we have resources on our website. So for medical laboratory science, we have an intro to MLS course that anyone and everyone can take that sort of introduces them into, you know, I guess the question, what is MLS, right? So it kind of introduces you into that, not only the field, but also our program specifically. So if you have, you know, some extra time in your schedule, feel free to take that class. It's offered in the summer as well. Similarly, for OT, we have an intro to OT course also offered every semester. So if that's something that you have the capacity to do, definitely do that. It just gives you more information about our programs so that you are, you know, that much more prepared. Lastly, I would say also on our websites are information about professional organizations that you don't necessarily have to join, but you can use them as a resource because they have articles about OT, you know, in the news, MLS in the news, people that you can connect with, whether virtually or in person in this area or wherever. So check out those professional organizations because that can give you more of an in-depth look into our program specifically.
Great, thanks for that, Tammy. I'm going to go back to Karen to see if she would like to add something.
Well, I think there's been some really terrific suggestions given already, and I don't know if I have much new to add to these wonderful suggestions. They are very true for veterinary medicine as they are for the other health professional programs. I think sometimes as undergraduates, if you are sort of navigating course planning, what undergrad courses do I take? I'm not sure what degree I want to pursue yet. There are commonalities. I think if you look at all the prereqs across most of the programs, the professional programs in particular, you'll find some of the basics, and creating yourself sort of a grid. I can kind of tackle these, and this helps me for this program or that program, can help you keep that academic ball rolling while you still explore the different professional options available to you. I guess I would also echo just the importance of those informational interviews. I think we all have understandings of what professions are, but they're complex and they're nuanced and they're deep, and talking to alumni, current students, people working in the field, getting different perspectives for different job paths within those fields are really important. Veterinary medicine in particular is a very romanticized profession. Most of our applicants will tell you that they wanted to be a veterinarian from the time that they were 4. I have a 6-year-old daughter at home who now wants to be a veterinarian. But really, it's a challenging and difficult profession. And so understanding the pros, the cons, the wonderful things about it, and the challenging things about it, and the earlier you do that, I think is helpful and will help you navigate your way to finding a career path that works for you.
Great, thanks for that, Karen. I know we have covered a lot of good things, but I want to give Olivia and Susie a chance to add in. So I'll jump to Olivia next if you have anything you'd like to add in here.
Sure, I'll just briefly add another thing that students attending our university have unique access to is current students in all of these programs. Not every university in the country has all of these programs. So I know that we are happy to, and I'm guessing everybody else here is happy to get prospective students in touch with current students to talk about their experience in the program. So make sure to take advantage of that opportunity, since there's such great access to those current students.
Great, thanks, Olivia. Susie, do you have anything you'd like to add?
Yeah, again, I'll echo, I think everyone has really great suggestions here. And I would say that a lot of us are utilizing that holistic review of applications. And so when it comes to the commonalities, I would say not just among coursework, but if you're somebody who knows that you want to go out and serve people as your career, right? If you want to be a healthcare professional, you want to serve others, demonstrating that in a sustained and meaningful way through volunteer experiences, through paid work experiences. Volunteering can be a privileged thing. So if you are a pharmacy tech and you end up being exposed to the field of healthcare that way, it's not as if you would exclude that from your application to dental school, right? That's relevant paid work experience where you were interacting with patients, where you were learning fantastic information. If you were somebody who had the opportunity to volunteer at, a clinic, it's not something that if you're applying to dental school, you say, whoops, I wanted to go to medical school, figured out that wasn't for me. Now I want to go into dentistry. I think that that's actually beneficial to you to be able to share how well you explored all the other healthcare professions, because then you can say with confidence, this is how I determined how I want to go into dentistry, for example. So just encourage you all to think through. I think some students, from my perspective, feel a lot of pressure to make a decision really early on. Whereas if you think we have commonalities when it comes to not only course requirements, but service orientation through paid work, through volunteering, research experiences. We always say we recommend research. It's not required, and it definitely does not have to be related to dentistry, right? So there are just common things that as you are working, as you're building yourself as a human, exploring what you're interested in, where your passions lie. I think it's something that will be beneficial to you eventually once you determine what healthcare profession you want to go into.
Great, Susie. Thanks for answering that last piece. That was actually going to be one of my follow-ups, because we had such a good conversation in advance the last time this group met regularly on seeing the value in students being able to share that they have explored other professions. It's okay to have that interest from very early, and, go forward with that. But it is also okay. And I see you nodding your head. I think that was the conversation we had, is it is okay for students to be able to share that growth and exploration that brought them to your particular professions, the specific professions. So I'm going to turn it over to Michael. Thank you all so much. That was great. I know we're not going to get through 130 questions. We might not even get through the few that we have chosen, but these are all such great answers. So I'm going to turn it over to Michael to keep us rolling here.
All right, thanks, Laura. So yeah, like Laura said, we had a lot of questions ahead of time, but one of the most common questions that we did receive was what makes an applicant stand out and what makes them competitive during the application process. It's kind of a broad question, so I know it might be a little more specific in case by case, but if you wanted to give kind of an overview of what that would look like, we can start. We can kind of do the same rotation if we want and see if anyone wants to bounce off of ideas. So Mads, would you like to kick us off?
Yeah, I think one thing that I was really thinking of ahead of time when I was thinking about this question was authenticity, of course. That's something that I know lots of us are looking for when we are connecting with applicants, reading through applications, is really just how you can portray yourself via writing. That's a really hard thing to do, but that's something that we do really value and look for. I'm primarily thinking of a lot of our applications do ask for a few essay type responses. And that's how we can really start to get to know you apart from a transcript, which is really helpful to us as just admissions folks and just reviewers, as to just who you are as a person. Of course, at some points, there is the whole conversation of statistics and numbers and breakdowns and all that stuff, but you are people at the end of the day. And so that's really important to the School of Nursing in particular, and I'm sure, again, others on this call too, but just authenticity and getting to know you better. And that's also something that really is like a thorough line through interview processes as well. It's getting to actually meet with you, connect with you, hear more about your experiences and your interests and what you want to seek from being a part of any health science career in general. I think additionally to follow that up is to, I think I might have mentioned this earlier too, but definitely ask questions, even if it's something that's really simple. It's really helpful to us just to know that you are engaged with our process and with the content that we might have online. That's just one really good way to also just get connected with us. So then we can also just know who you are and you can know who we are too on a different level as well. So those are certainly the things that really came to my mind when thinking about this question.
Awesome. Thanks, Mads. And I really love the authenticity piece. That's a big thing that we say within our office. It's always building a authentic and competitive portfolio. So that's definitely something I think all candidates should keep in mind. Dan, did you want to bounce off of that?
Well, I think Mads really summed it up. A lot of the thoughts, at least that I had, the only thing I would just add to is just, it's that combination of commitment and preparation, right? Is what at least we're looking for. And the commitment is shown in previous experiences, but really a lot in that personal statement. I personally have I put a lot of emphasis in the personal statement because that is your personality. That is in your words, why you're doing this, why you're pursuing this, and your opportunity to really show the admissions committee that this is something that you have thought thoroughly about and have committed, that because grad school, many of these schools are multiple years and beyond, and we want to know that you didn't enter into it lightly, right? And that especially in times of economic downturn and things like that, a lot of people just turn to graduate school and they think, I don't know what else to do, so I'm going to go to graduate school. And that's not a reason to pursue any of our programs. It's not a hideout for anything. It's a big investment of time, money, and your future. And so for me, the personal statement is a way to show that. And then that preparation is really about, if you have met any prerequisite courses, what other experiences have you done, again, to showcase and demonstrate that, you've got a direction. Public health, like I said, is very broad, but, we don't expect that students are going to know what their 5-year, 10-year life plan is and lay that out in their personal statement, but we want to know that they have a direction. And we know, and we're fully aware that students change their minds over time. But the key thing was that we don't want students entering into this lightly. And so that's how students, for me, can stand out, is how they demonstrate that commitment to this profession and field.
Great, thanks, Dan. And I know you had mentioned, experiences. That's kind of a follow-up question that we have. What kind of experiences do you find valuable for an application to your program? And I know that's something mentioned in the Q&A as well. So Crystal, I don't know if you'd want to kind of expand on that and what experiences you kind of look for.
So do you just want me to focus on experiences or still answer the question too beforehand? You guide me, Mike. You let me know.
You can do a little of both. Definitely what stands out, and then kind of how that ties into experiences.
Okay, sure. So I would say one of the things that Susie actually already mentioned was the importance of the fact that we all do, I think, for the most part, a holistic review. And so because of that, specifically at the medical school, it is competency-based, meaning we have a set of competencies where we are looking for you to demonstrate these competencies throughout your application. I'll share those competencies. I'll drop a link. We have a living Word document that you can actually see on Google with these competencies. And so as you are thinking about your experiences, specifically service orientation, right? If you are thinking about potentially any of these health careers, you really need to think about how you are telling us. I think it's really important to think about, right? I know that there was something, one of the questions that mentioned online volunteering versus actually doing in person. I think the reality is with COVID being a part of our everyday lives, this is the new normal. The new normal is to fill out an application and be able to reflect on the opportunities you've had virtually and in person. I think that you shouldn't underestimate, I think, the ability to still get connected, especially because as I've been a part of different panels, visited with a lot of different types of students, every little thing that you could potentially do to help others can be relevant and important. I heard some people volunteering to read to kids or doing a buddy where they're connecting one-on-one and sitting down and reading while parents are doing other stuff at home. That stuff is tremendous. I think Dan also mentioned the importance of taking a look at what you're doing in your everyday life. That matters, that counts as experience. If during COVID you had to take care of a family member, if you had to step in and help with homework because you had younger siblings, that is all relevant and important outside of all of the other, I think, volunteering opportunities that you could have the option of doing. Those things matter. So like I said, if you're thinking about the things you already do, start writing these things down. I think that you can sit down with any of us or any individual that's just like, hey, here, this is what I've done. What are your thoughts? Does it sound like I'm missing anything? These are the competencies they're looking for. And I think also don't rely on just putting these in a resume. Make sure that you use concrete examples. Make sure that you are really interweaving these competencies throughout your application. I hope that helps.
Yeah, that was great. Thank you, Crystal. Tammy, did you have anything to add to that?
I feel like Crystal summed it all up perfectly. I think what I might add, specifically as I'm thinking about our MLS program. So we look at your transcripts. The important thing to know about that is that, yes, we'll look at your cumulative GPA, but then we'll also take a deep dive into, the GPA that you earned in our prerequisite courses. We'll take a look at your science and math GPA. Right. So we're dissecting those and making sure that it matches up and academically where you are. But we also give you the opportunity to kind of explain irregularities, right? So don't be afraid to do that in your application. If you we're all human and things happen. This past year with the pandemic, over a year, has been crazy, and it's affected us all in different ways. And we all have different things on our plate. So it's important for us to get outside of outside of what we can see on the transcripts. It's also important for us to get to know you, the applicant, the person, right? So use those spaces that we make available for you on our application to just kind of explain and tell us more about you, and tell us, if there's something in your academic background that might raise a red flag, tell us why, tell if to your comfort level, what was going on and things like that. So those are all things that we take into consideration as well. For our occupational therapy program, it comes with a minimum observation hour, 20 hours is our minimum. So I think, as Crystal hit on before, as well as others hit on before, make sure you're writing those experiences down now. So that when you sit down and it's time to apply and you're thinking about these different programs, you don't have to kind of go back in your memory bank and think about it. Just make sure that you start to do it now. And that encompasses everything and all of the things that you've had experience in. So make sure you're just jotting those down and that you are taking those into consideration.
Great, thank you, Tammy. And then, I'll just kind of like cruise through the rest of the panel. If you want to have anything to add to that, that'd be great. Karen, is there anything you'd want to add to these?
Again, some really great suggestions I've already given that I think are applicable to veterinary medicine. One thing perhaps unique to us is that, of course, we are looking for animal experience as well. So we love the human side and supporting human health and such, and that's great. We consider that relevant as well, but also making sure that you're engaging in animal care, and also time spent with a veterinarian, shadowing veterinarians, again, learning about the different aspects of the profession. That's really important as well. Another thing, we have 2 essay questions. One is service-based, and I think folks have already talked about great ways to get involved service-wise, so I won't talk much about that. But our other essay question is about diversity, equity, and inclusion, what an individual contributes to DEI work and how they have supported diverse communities within their background and past. And so I think sometimes that has to be planful for people, and making sure that when you're thinking about different ways to volunteer, are you volunteering to support diverse communities? And if not, making sure that you're being cognitive and strategic about including that as well into your plan for gaining some experience there.
All right, thank you, Karen. Olivia, is there anything specific to pharmacy you'd want to add?
I'll just mention that in pharmacy, we use a similar approach to what Crystal described, where there's specific, we refer to them as skills and attributes, but competencies, characteristics. And I think a lot of students really kind of like undersell their experiences. I see a lot of students who are like, oh yeah, like I was a bartender, but that doesn't have anything to do with this. Being a bartender is remarkably similar to working in a retail pharmacy in many ways. So customer service skills, your ability to work under pressure in a really fast-paced environment. So I just would encourage applicants to think about every experience and what are the transferable skills and what are the competencies that they gained in that, because literally everything you do, I bet you can figure out something you learned from it or you developed from it that will apply. But I see a lot of students being really dismissive and saying like, oh, well, I don't think that's very impressive, or they're not going to care about that. And we care about all those seemingly unrelated experiences, and we really value what you got out of those.
That's great, Olivia. Thank you. And then Susie, did you want to add something as well?
Yeah, I was just going to say that when people ask me what the biggest mistake people make in their applications is, my answer is always the error of omission. Just really wanting to reinforce what Olivia was saying, that, it's shocking the amount of people that I learn about experiences that you participated in when I'm reading your letters of recommendation, where I learned that you did research and you presented at a national conference, but you didn't enter that within your application. So just really want to drive the point home that, we're all looking for a wide variety of experiences. I can speak specifically to the dental school, obviously, but when we're reviewing applications, we're looking at all of these different pieces. And I just also wanted to add, You had mentioned what makes somebody kind of stick out and competitive. For me, applicants that really stand out are those who come across what I call is like humbly confident, right? So somebody who understands that they don't have all the answers, that they've started on this journey of exploration, that they're excited to continue on, that, the phrase lifelong learner gets thrown around a lot, but when you're mandated to do continuing education as a part of your career, you are going to be a lifelong learner. But those people who are humbly confident are so because they know they've taken the time to get to know themselves and where their strengths lie and why they're interested in a specific career. They've developed genuine relationships with people that can write strong letters of recommendation that provide insight into not only their performance in a class or a lab or in a research or at a paid job or volunteering, but who you are as a person, and that you are interested in a career because you do have a strong interest in supporting your community and giving back to others. So yeah, I would say that people who have put in the time, the work, the exploration, are really those who come across as humbly confident in the application process, and that is throughout everything, their entire application, their letters of recommendation, how they choose to communicate with the admissions staff, how they show up on their interview day, etc.
Awesome. Great. Thank you, Susie. And thanks, everyone. Those were really great answers. So we appreciate that.
All right, we're going to move on to our next topic, which came up a few times in our last question, but I'm going to hone in a little bit more specifically on that personal statement. The personal statement is something that our office works with probably hundreds of students each year with. We have a writing a personal statement course, a 1-credit course. We have an online workshop and our counselors meet one-on-one. So we know that that can be a really important piece of a student's application to be able to, many of you said, kind of like show up as a person outside of check boxes of application. And so I'd love for you to share just a little bit about what advice do you have for students writing a personal statement, advice or examples or insight to that process, being on the admissions process, and what makes you read a statement and go, wow, like I want this person as part of our program. So I'm going to go back down the other line. I'm going to start again with Susie and we'll go down the line the other way. So Susie, care to share?
Yeah. I review hundreds of applications every year. So when people ask me this question, I'm like, please do me a favor as someone who is reading all these applications, and try not to regurgitate everything that I just read, right? So in a centralized application, the way it shows up for us with AdSAS is I go in, I read all about you as a human being, I read about all the experiences that you have engaged in, and then I come to your personal statement. So for me, that's one of the biggest things is your personal statement is an essay. It is not asking you to go through everything that I just read as far as I did this and then I did that, I developed this skill, I explored this, I went there. To me, that's something where it's easily forgettable. People who write personal statements that really, I would say, give light to who they are as a person are sharing often stories or a story that hasn't shown up anywhere else in their application. The prompt is really easy for dentistry. It's one sentence basically about why you want to be a dentist, right? So there's not too many parameters for you to go on, which I know is frustrating for applicants, but really well-written personal statements, it is a writing sample too, right? So it should be easy to follow. It should pull in your reader. It should highlight who you are as a person. And for me, I really like to see that in a storytelling form and to tell something about you that I haven't gotten the opportunity to know yet in the rest of your application.
Great, thanks. Olivia, I'll go to you next.
Ditto to that, as someone who also reads, with our process, the admissions staff actually score all of our personal statements for writing for that skill. So read lots of those. I think the biggest advice that I usually give people One is to answer the prompt, which it sounds like for dentistry is not quite as complicated as it is for pharmacy. Pharmacy is a really long, convoluted paragraph prompt, but it's asking two questions, which is why do you want to be a pharmacist and why do you think you'd be great at it? So making sure that you address both parts, because I read a lot of personal statements that are just like, here's why I want to do this. And I read a lot that say, here's why I'm really fantastic, but don't necessarily address both pieces. The other thing with answering the, for us, why pharmacy, or for any program, why you want to do it question, this might seem like I'm stating the obvious, but make sure you actually answer that question specifically for the program that you're applying to, because I read a lot of personal statements that I could substitute any other health profession and technically it would fit. It's like, I want to do this because I want to help people and I'm interested in healthcare. It's like, it doesn't get quite specifically enough at what was it about pharmacy that made you specifically choose this. So really kind of digging into the specific things about the profession that were attractive to you or you think are a good fit for you, because a lot of our personal statements just don't quite get there in terms of that specificity. And again, like you literally could just substitute dentistry and it'd be like, yeah, technically all of these things are true about that field as well. So digging into the specifics of the why, and then again, depending on the program and what the prompts are, making sure that you address all pieces of it and don't just focus on like one piece of the prompt.
All right, thank you. I'm gonna pass it on to Karen to see if she has anything she'd like to add.
Yeah, good suggestions by Olivia and Susie. I would reiterate the importance of having a well-written statement in terms of grammar, spelling, punctuation. It is worth points, and it's kind of heartbreaking to see people lose points on something as simple as grammar. And so as writers, it's really easy to look at something, you read it 15 times and you miss something important, a word, punctuation, and then you have somebody else read it and they catch that right away. So having other people read your personal statement and giving you feedback, I think is helpful. Taking advantage of those workshops, visit the PHSRC, those things really important. For veterinary medicine in particular, as I mentioned before, a lot of people are influenced to find this career when they're really young, and they oftentimes start their personal statement out with talking about how when they were 3 or 6 or whatever, they wanted to be a veterinarian. And we are interested more in your adult thoughts around that. So when you decided in high school or college or whenever that time was, why this was the profession for you, that is going to be more influential, I think, than starting from a really young place within your history. And then also, you do want to stand out, and you want to be unique and be notable, but don't go too far in the other direction where your personal statement becomes too odd. For example, we've had personal statements written from the perspective of the dog. Probably not going to happen in other health professions, but the dog is telling the story about why the student wants to be good and would be a great candidate. And it's like, no, that's too far in the opposite direction in terms of standing out. So be careful if you're going to take a super unique path to it, that you're not veering too far off path.
All right, thanks, Karen. Yeah, maybe vet med would be the only profession that people would be writing from perspective of a dog. But if you're getting in that creative mode, you never know. I'm gonna check with Tammy to see if she has anything that she'd like to add around the personal statement.
Yeah, I just kind of lost my train of thought with thinking about the dog writing the essay. Yes, I would echo really what Karen said as well, in that make sure that that you are really concise but clear with with your answers to the essay questions. So we have, for both of our programs, we have a centralized application system as well. So there is a character limit, not a word limit, but a character limit. So, and it's 3,000 characters, which sounds like a lot, but when you start writing and you're putting all of your thoughts in there, you can fill 3,000 characters pretty quickly. So just make sure you're clear and concise with your answers. I would say go into the application, copy and paste all of those questions into a Word document and write it out in a Word document first. And as other colleagues have mentioned, have someone else who doesn't even know a thing about, you know, our program, read it to see if it makes sense to them, so that it can make sense to others as well. Specifically for our occupational therapy program, I don't want to scare anyone, but we have 7 different prompts that you have to answer. It sounds like a lot, but it's really not. They're very short and they're actually pretty fun. So they range from you know, leadership. You have to talk about stress and how you handle that, diversity, your interest in the program and into the profession as in general. And so going back to what was said earlier about showing up as your authentic self, I think how you really show up as your authentic self in these answers is to make sure that you're starting now. It's never too early to start weaving in those experiences, and make sure that you remember, like if you're answering the leadership question, it doesn't have to be leadership necessarily within the occupational therapy field, right? Think about everything that you've done in the past, your culmination of your work experiences. Is there a leadership position that you've had when you were a bartender, right? Like what did that teach you that is also applicable to applying to this program? So I would really encourage you know, applicants to really think about that and think about their holistic experiences and not just contain themselves to the occupational therapy program itself. For our MLS program, we have an optional statement, which I mentioned earlier about if there was anything else that you would like to add so that the admissions committee can take a look at that. So it is an optional statement. In lieu of a traditional statement, we do have interviews, which all applicants will interview with 2 of our faculty members. And applicants tend to get really nervous about this. But you know, our faculty are people too. And they just want to know about you and why you're interested in the program. So again, while it's not written, it's oral, just make sure that you show up as your authentic self and, you know, really express, you know, like, you know, brag about yourself, express why you're interested in the program, the experiences that you've had, and, you know, why you think you'd be a good fit.
Great. I know once we get about halfway through it, and that doesn't always feel like you might have something to add, but I always want to make sure we get through everyone. So Crystal, do you have anything that you'd like to share about reading personal statements and advice for students?
I think that a lot was already shared. I think that one thing we commonly see at the medical school is individuals who will take their resume and do a summary as their personal statement. And I think that in particular for the medical school, this is your opportunity for you to tell us something we haven't been able to see throughout your application. So maybe something you weren't able to list under your experiences, something that, because we have shared our secondary or supplemental application questions online. So you have an opportunity to see those in advance to see if you'll even get a chance to answer some more information there. But if not, when you're filling out your personal statement, this is it. Like, what do you want to share with us? What do you want to share with potentially your future colleagues? What do you want to share with your, you know, future classmates even? We really pride ourselves on putting together or working with the community, our medical school community, to be able to be part of the application process. So keep that in mind. I would also just say, I think a lot of students sometimes forget to see themselves in as a future physician, right? So think about what you would like to do. Why medicine? Why do you want to make the difference? And just make sure you're aware of who your audience is when you're writing that. I think sometimes it's easy to just be like, oh, I looked up a program and I can't wait to get involved in that. Don't keep it so surface level. You know, if you have an opportunity to really talk about why this is a passion of yours, do so.
Great, thank you, Crystal. Dan, do you have anything you'd like to add about a personal statement?
Well, Crystal just stole my whole thing just there, especially at the end. I was like waiting, listening to everybody's like, they can say it. But for me, it was really know your audience, because I think some of the folks here have said that they are on the admissions committee, they are reviewing applications so they can speak from their experience. But at School of Public Health, for us, it's majority faculty that are reviewing the application. So knowing your audience, know who, so whichever program you're going to, know who's going to be reviewing this at the end. And as Crystal mentioned, faculty, you'll want to go deeper than just telling them, I did a Google search and I found this program and I thought it was interesting. These are faculty members that have dedicated their career to this field. And you're not going to rise to the same level of passion and commitment they're at yet, but they want to be able to see that you have that commitment. These are things I harped on this whole panel, was that commitment. And so you want to make sure that that comes through in that personal statement, and that it is deeper than just that generic search. And so I wanted to reemphasize that is to know your audience.
Great, thank you. And Mads, do you have anything you'd like to add to this conversation here?
Yeah, I think just what everybody else has said already, of course, but I think 2 tips that actually came to my mind. We were recently just talking about this in a nursing information session, was to not only have these specific prompts up, but to do pre-planning before you're even looking at how you're wanting to even write it. So like mind mapping, bullet points, some, more general essay writing type of tips and tricks there is really helpful in making sure that your thoughts and experiences translate well to our admissions team, which of course really ties into the specifics of what we're looking for, making sure that it's not too general, of course, too. And then just the other one that really came to my mind is, of course, having other people proofread it, read through it, clarity, all of that amazing stuff that can come from that, but also utilizing like auto transcribing. So while you're actively writing it, you can utilize, online or computer features, whether it's on Google Docs or Word doc or other document portal or platform you might be using to have the computer read it back to you. That's been something that's been super helpful if you are maybe in a little bit of a pinch, or you might not know who to necessarily reach out to. That's just a more readily available tool that is really helpful to a lot of folks too. So those are just some kind of closing thoughts there.
All right, and Olivia, I see
I thought of one more very technical piece of advice, but I see this a lot. Tammy mentioned like copy paste in a Word, like write it, do that. But when you copy and paste it back into the application, look through it, because first of all, funky formatting things can happen, like you see weird characters and like /n for a paragraph, and but the other thing that I've seen happen is that the essay gets cut off because our application system has a character limit, and if you wrote more than that in Word and didn't realize it, I've seen personal statements end mid-sentence. So if you copy and paste it in, make sure that you review it very carefully. So we've said all the philosophical advice. That's a more technical piece of advice.
Well, that's very important too. And it looks like Dan's got another one to add here.
No, I just wanted that it's a great, piece of advice, even though it seems very technical. And I think a lot of the things that we've been talking about tend to be very minute, like details, but that's really what all of our professions are about, are those details. And I think that sometimes, an admissions committee member may say, read a personal statement and see, a few grammatical errors, fine, but like if you totally messed up a formatting or referred to the wrong school, when you're in the profession, that could be meaning prescribing somebody the wrong medicine or writing down their name wrong, and then something doesn't get linked up. So we are in the profession of a lot of those details. And so as nitpicky as it may seem to like say, when you're copying and pasting it over, make sure that the margins are correct, that's important. So just, I think about all these things collectively, and it seems very detailed, but it is really important to all of our professions. So don't overlook that or not put the importance on it that it needs.
Great, thanks for those additions there.
All right, I'll move on to the next question. We kind of covered some of these topics already, but obviously the pandemic has really affected both the admissions and pre-health students as they're working to apply to these programs. So what are some suggestions you have for how students can still obtain beneficial experiences, and have you adopted any changes in the way that you review those parts of the application? And we can mix it up a little bit. Why don't we start with Tammy?
Yeah, so this is such a great question, and I feel like it should be prefaced with, like, first of all, like, applicants, I don't want anyone to feel like they are alone in this. Like, the pandemic in this past year and a half has been crazy for all of us, and we're all still really adjusting. So I think that's important to note from the top. We have adopted some changes just in, our application process for MLS, for medical lab science. We have switched to doing our interviews virtually. I feel like we can all remember a time where you were, trying to get to a meeting or trying to get to an interview, and you're trying to figure out where to park and how to get there and who to meet with. And by the time you actually get there, you're probably like a sweaty, stressed out mess. So that kind of takes some of the, we hope, some of the stress away from applicants. It's already kind of stressful enough just talking to two faculty members as an applicant. So we hope with this virtual setting, you're able to relax a little bit. You're able to have your, your comfortability in wherever you are, so you can come as your authentic self in that interview process. For any and all experiences, both for the medical lab science program as well as the occupational therapy program, we do accept telehealth hours for those experiences. So if it's observation hours, if it's internships or anything like that, telehealth hours do count. So if you can be in person, that's great, but we realize that that is not attainable for everyone. So we do have flexibility in our hours as in the way that you obtain your hours as well. And then for our prerequisite programs or courses, for both programs, I know that, the switch to 100% virtual classes and virtual work it's not as easy for everyone as it might be for, for other people. And so for the semesters between spring of 2020 and spring of 2021, we do accept S grades for our prerequisite courses. Do we prefer A through F? Yes, we do, but we will accept S grades, and you can absolutely use one of the essay prompts to, elaborate on any grades that you've taken an S in, if that's something that you feel comfortable doing.
Great, thank you, Tammy. Karen, do you want to go next?
Yes, absolutely. So I think, that we've done some adjusting as well at veterinary medicine in terms of our expectations for what students are going to come to the table with in terms of experience. We understand that the applicant that's coming up now may look a little bit different than the applicant that didn't need to go through COVID while they were gaining their experience. And so I think that can take the pressure off a little bit in terms of what people are planning for. And also remembering the things that we talked about in relation to previous questions, that experience can be broad and it can look different for different people. There's no one size fits all, recipe that an applicant needs to follow to be successful. And so pulling in other pieces, maybe it's previous job experience that you've had pre-COVID, or maybe it is something virtual that you've done during COVID. Those are still really relevant and applicable. And then also for some people, allowing themselves some time to catch up if that's needed. That maybe that's a gap year for some people, and different programs have different thoughts about gap years. So you would want to, check in with individual programs for advising on that. But for veterinary medicine, for example, if you graduate from your undergrad degree and take a year to explore the career, get experience, make sure that this is something you really want to get into, excellent. We think that's great. take that time and make sure that you're again, making a good decision for yourself and allowing yourself that extra space and time to, catch up per se, if that's needed.
Thank you, Karen. Susie, did you want to go next?
Yeah, so we used to have a requirement of 50 hours of general dentistry shadowing for all applicants to be eligible to matriculate to the dental school. We waived that requirement due to the pandemic last application cycle, and we're also waiving it this application cycle. Although we are making sure we tell all of our applicants, we're still looking at your exposure to the dental field. So, more than ever now, people are talking about smile shadowers, so virtual shadowing experiences that they've been able to engage with, informational interviews that they've done with dentists, which I have been very impressed by some of the applicants who have showed their resiliency and determination and continuing to reach out to people throughout this and really kind of having a growth mindset throughout this process of how can I navigate this challenge and continue to find opportunities to explore. So using Coursera courses, meeting with people via phone, via Zoom, thinking about how they can give back to their communities in other ways. So people have talked about, 7 Cups is just one example of online volunteering, or people have started to say, I created this, virtual tutoring for parents who have their kids at home so they can get some work done during the day. So there are kind of like endless examples that we can probably all come up with of applicants who have really demonstrated what they've been able to do throughout the pandemic. So I would say the biggest thing would be waiving the actual in-person shadowing and then changing over to virtual interviews with an optional in-person visit day. But applicants, are able to continue to enter virtual shadowing, other experiences that they have been working on. And then we review applications from that lens of they are applying still during a pandemic. So it's something obviously that the admissions committee, the admissions office are all aware of when we review applications.
Thanks, Susie. Olivia, would you like to go next?
Sure. So for pharmacy, and I believe this is true for a couple other programs as well, the central application that is used for our application process actually has a specific prompt related to how you might have been impacted by COVID-19. So for pharmacy, you have a dedicated place on the application where you can explain, did you have to move out of your residence hall, on a moment's notice? Did your classes all change online? Did you have an experience fall through that you had lined up for summer 2020 and then it ended up being canceled? So there is an opportunity to share some of those things that might have impacted your application, and our admissions committee certainly lived through all of this as well. So we're definitely understanding that our applicants' experiences are going to look a little bit different than they might have historically. One of the things that we are recommending in pharmacy, shadowing was getting to be more and more difficult even before the pandemic because of HIPAA laws and patient privacy concerns. So we were already hearing that applicants were having difficulty with that. It's even harder now. So we really recommend informational interviews. I know that, folks are busy and it can be intimidating to ask someone, but I promise that people love to talk about themselves. So if you reach out to someone, and just say, could I ask you some questions? And we've even got suggestions on our website of questions that you can ask them. We have a form you can fill out for pharmacy, and we'll put you in touch with one of our practice faculty if you'd like. But those informational interviews, if you can't actually experience a day in the pharmacy, you can at least ask them, what's a day in life? What are your favorite things about the job? What are your least favorite? How did you end up here? So we're really encouraging folks to do those informational interviews as a potential replacement for shadowing.
Great, thanks, Olivia. Crystal, would you like to go?
Sure. So ours is similar to what Tammy described in terms of prereqs, accepting pass-fail for 2020 through 2021 courses, again, depending on what the situation was for either the U or any other institution that students may have attended. I would say the other thing is You may have heard that last cycle we went MCAT optional. This cycle, the MCAT is back on the table. It is a requirement of the application, so it is no longer optional. So that is one of the changes that kind of happened, but now we're kind of trying to go back to, I think, a little bit more of a typical cycle in that way. We are also encouraging students to consider, again, as I mentioned before, virtual opportunities. I know that with COVID, I think a lot of our mental health maybe shifted a little bit. And so there is always a need for crisis counselors. They typically provide about 30 hours of training. You can do some problem solving. You can learn some reflective or active listening. So if you are looking for virtual opportunities that would take place 24/7, crisis counselors are always in need. So that's my plug for other types of opportunities that you could do. As far as how we've shifted, how we do our review, I think that we also have a COVID-19 question that's part of our supplemental application, where you have an opportunity to share what the experience was like for you. What did you encounter? What did you do? How did life change for you? So that is one thing that's different, but we are, I think, as an admissions committee and even all of us that review files, just keeping an eye on how things are changing and not necessarily marking it as like a deficit. Oh, they didn't have X, Y, and Z, but just making observations. What competencies are you still demonstrated? What skill sets, what attributes, etc. So again, even if you're feeling like, oh, I wish I could have done more, you'll have an opportunity to say, if the world were different, this is what I had planned to do. But in the meantime, this is what I was able to do. So I would really try to focus on what you were able to do and don't think of yourself as less than because you didn't get to do all these things. I think managing a pandemic is not anything any of us were experts in, but we're still here and we're still moving along, and hopefully you are as well.
Great. Thank you, Crystal. Love the positive spin. Dan, would you like to go next?
Yeah, I have nothing much more to add, but other than just, as again, Crystal was saying towards the end, is kind of fill in the gaps for the admissions committee. Feel free to explain if these are things that I recognize that I may be missing or lacking on, that I'm sure would be helpful for this for the program. This is either my goal or my commitment to getting this done prior to coming in. So sometimes it's a course or sometimes it's an experience. Just kind of disclosing that and just being open to saying, I recognize that I might have this deficiency. It's due to X, Y, Z. I mean, we're a school of public health. We definitely know this pandemic has affected everybody in all kinds of ways. So they're very understanding and flexible. And so part of that is also through the specific questions that we have in the application around COVID and how it affected you as well. So we have that similar process too. So that's all I'll add.
Great, thank you, Dan. Mads, would you like to add anything?
Yeah, definitely echoing what other colleagues have mentioned around pass-fail grades in terms of the height of the pandemic and so on. In regard to our applications, we also no longer require the GRE for our Master of Nursing program, which is very exciting and very helpful. Additionally, when it comes to beneficial experiences to kind of keep note of, we are talking a lot about nursing for social change in our school. So in the ways in which you can be a community advocate, ally, and what that looks like in terms of how you are doing outreach, volunteering, or even, I think it was kind of mentioned earlier on too, how you might have even stepped up in your family or in close relationships in terms of taking care of other folks. Those are all really beneficial things that we are looking for and keeping in mind when it comes to relation to the pandemic. Additionally, online experiences are something that we do take into account. But like others have mentioned, we do also want to know maybe why a experience maybe fell through or how you maybe supplemented that with a different experience. Those are all really valid things that we want to just make sure that we know of throughout your application cycle. And additionally, having broad experience is not a bad thing at all. I know others have mentioned that as well, but certainly the ways in which you want to apply that to potentially a personal statement or how you want to intertwine that in your resume is also really helpful and effective to us to see on our end as well. So those are just a few little glimpses into what we look for and what could be beneficial to you.
Great, thank you, Mads.
This has been so wonderful to have this conversation with y'all today. And I know we're about out of time. But I let the panelists know that we'd be taking this last question pretty quickly. We'll see if we can get through everyone. And it's just kind of a quick, maybe an easy answer, maybe not. But our last question is to just go around and do a round robin of what's your top do and don't piece of advice for applicants. And so I'm going to go around, I'm going to go off of my list and go around on my board here. I'm going to start with Dan this time, and then we'll close things out when we're done.
I would say do the process early as you can. So making sure to be mindful of how long the application process may take and keep in consideration deadlines. This group has heard me say this before, don't be a jerk in the application process. So how you communicate with the people you encounter along the way, sometimes they're busy, they may not get back to you right away. And just being aware of your personal presence and what you're bringing into the energy you're bringing into conversations and how you ask questions, because again, that is reflective of how you might be as a professional, and that can cause some unfortunate concerns. So just kind of keep that in mind.
All right, thanks for that, Dan. I'm going to pass it over to Tammy.
I would say do plan and organize. Our program specifically, and I probably all the programs represented here today, have prerequisites that need to be done, and those happen on a semester schedule on when you can get those done. So do plan and organize. Don't wait until the last minute, and just know that we're here to help you answer those questions.
All right, Crystal, your top do and don't piece of advice.
All right, I would say do your homework in terms of which program, which college, medical school. People apply to multiple schools. Make sure you know these medical schools inside and out so you can ask good questions so that you can be prepared and so you don't accidentally upload the wrong information to the wrong application. Don't be afraid to be vulnerable, but don't be dramatic. And I say that in a sense where sometimes I think we can take these heart-wrenching stories and tell them or use them throughout our application. But sometimes I think we can get caught up in the story and forget why this motivated us to do what we wanted to do. So again, be vulnerable, but not dramatic.
All right, thank you. All right, Susie, your turn.
I would say do use your resources. So that includes the Pre-Health Student Resource Center, your peer counselor, your academic advisor, people you've made connections with. Also resources that are easily available to you on the interwebs to do your research on the schools that you're applying to, etc. I would say don't rush your application. I'm sure we've all received the email of the person saying, I'm scheduled to take my standardized test at the very end of December and your deadline is a few days away, and I just want to submit my application as fast as possible. So I would say, take a pause and think about which application cycle does it make sense for you to apply in, when will be the most prepared and the most competitive as an applicant, within a few years time frame, obviously. So do use your resources, don't rush your application.
Great, thank you. And Karen.
Well, mine was going to be the do plan early, but since that's been covered well, I will say do try again. So if you apply to a professional program and if you're not successful, get feedback, be proactive, follow the suggestions that you're getting, and try again. Lots of really great health providers apply to school more than once, so don't give up and try again. And then another vote for do not procrastinate. You're not doing yourself a favor. Organized and timely, have a time frame in mind for when you need to get things done for applying, and you should be good to go.
Great, thank you. Mads.
Yeah, do be kind to yourself during the application cycle. That's very important and something that not only, extends to just niceties around yourself, but also to earlier points. It's just good to be nice to folks that you're working with too, of course. And then definitely don't think that all programs are the same. That's one thing, especially within nursing, where a lot of different programs at different schools sound really similar, but have really different features. And so just be sure that you're not confusing anything that could, end up getting lost in a personal statement or resume. Just super helpful to be sure that you're doing that research too. So those are my do's and don'ts.
All right, wonderful. And we'll close it out with Olivia here. Olivia, what would you like to add?
I'll give a do and don't specific to any applicants that might be doing what we refer to as the optional essay, that most of us have the explain something about your application that might need more information. So I'll say do provide explanations, don't provide excuses. That can be a really fine line with trying to provide context and additional information if you had a rough patch in your grades or something that you think might need additional explanation. But we're not looking for blaming there or excuses. We're looking for ownership of what happened and an explanation and how you've recovered from that or how you've overcome it. So that's kind of a specific to one part of the process, do and don't.
Wonderful. Well, we got through 5 questions of 130. So we'll be able to tackle more of these in the days and weeks and probably months that will come after this. But I want to take the time to thank all of our panelists so much for taking an hour and a half today to have this conversation, to answer some of these questions, and to be able to share some of the similarities and differences among the health science programs at the U and the ways that you all are considering applicants as they come through the cycle. So thank you very much. Thanks to those of you that are still here listening in. We will be making this recording available and, like I said, trying to answer more of those questions that came in. So thank you. Have a wonderful rest of your day.